Hi, this is Dr. Padda, and I want to talk a little bit about migraine headaches and the use of therapeutic nutritional ketosis. I think it's important for patients to get additional information regarding this, and sometimes we don't have enough time to actually go over this in detail in the clinic, and why it's relatively important for them to change their dietary intake, especially if they have migraines. And I think it's because patients don't recognize what the underlying cause of migraines is. And I think once patients realize that, then that may help them better understand this. A migraine is really an escape focus of a seizure that's occurring in your brain. And you get these cortical spreading depressions and these cortical spreading seizure-like activities in your brain that cause a zinging or headache type symptomatology. It's the same neuronal activity that you see in a seizure disorder. And that's why there's a prodrome, there's the actual migraine headache, and then there's a postdrome of where people are kind of worn out after they've had this seizure-like activity in their brain. A lot of the medications that we use are used to decrease seizure activity, especially the gabapentinoids and things of that nature. The key element here is that the medications are beneficial, definitely, but the dietary change of increasing the amount of ketones is really beneficial as well. And what the ketone does is it gives the brain an alternative fuel source. So if you get rid of the sugars and your body instead starts to produce ketones, and how you get to that diet is something that we'll discuss in a second. That ketogenic diet itself causes a reduction in inflammation. It causes a reduction in the irritation of the brain. It improves the mitochondrial function, and it increases an inhibitory neurotransmitter called GABA. GABA-aminobutyric acid is something that reduces inflammation, and it causes a change in your ability to relax. It makes you more relaxed. It improves your sleep capacity. And the more inhibitory neurotransmitter GABA you have, as opposed to glutamate, which is an excitatory neurotransmitter, the more GABA that you have, the less irritation you have in your brain and the less seizure-like activity you have. So one of the things that we do is to encourage patients, certainly we use medication, but encourage patients to change their dietary intake. And what that would mean is get rid of the processed refined carbohydrates, get rid of the things that are going to cause increasing inflammatory cascade, and increase the amount of healthy fat and increase the amount of protein. We want the patient to get as much of those two elements as possible. And you can certainly, and we recommend, measure ketone levels, but not every patient will measure those, and not every patient will have the capacity to. So you can measure them by either a blood test or a urine test. And those are two methods that we sometimes will recommend for patients that are really getting into trying to manage their headaches with a pure ketosis diet. It's also been shown to be very effective to manage global seizure disorder. So we do have patients who are recalcitrant to medication therapy, and we put them into a therapeutic ketotic diet, and it immediately reduces their seizure activity. So those are the kind of the things that we want to discuss regarding this. I have a more detailed checklist on getting into nutritional ketosis, and we spend a lot of time, and we have other methodologies to do it than just pure dietary change. Sometimes we even will supplement somebody with a healthy oil that will then turn into ketones, and that's typically an MCT oil or mid-chain triglyceride, which is basically a modified coconut oil. If you have any other questions, please feel free to reach out to me. I have a checklist below if you want to download that, and then when you're in the clinic, ask me the questions so that you have a basic fundamental understanding of where we want to go with this ketosis. Thanks so much.